For those of you who weren't here last session, it's my pleasure to reintroduce Neil Pearson. Neil is a physiotherapist, yoga therapist, and clinical assistant professor at the University of British Columbia. He works clinically in Penticton, BC, exclusively with people with complex pain conditions. Neil is an international educator, the founding chair of the Pain Science Division of the Canadian Physiotherapy Association, a board member of Pain BC, and the recipient of the 2012 Canadian Pain Society's Excellence in Interprofessional Pain Education Award. His passion for physiotherapy, pain management, and for teaching pain science is matched by his efforts to integrate Western pain care and therapeutic yoga. To learn more about Neil, please visit lifeisnow.ca. Welcome, Neil.
Thank you very much, Michael.
It's great to have you here again. I'm just going to pass presenter status over to you so that everyone can see Neil and streaming live from Penticton.
Good. I think I've got it now. Is that right, Michael?
Yes, we are now seeing you, Neil.
Okay, great. Well, welcome back, everyone. Not sure what it's like on the coast, but we have another sunny day here. So what we wanted to do is jump right into some of the questions. Interesting looking at the questions, so we've got a lot of them. We will be looking at trying to answer them during part 2 today. So if you're here for the questions and for the part 2, you will be hearing some of the same information twice. So I'll start with the first question that we received, and it was, what happens when pain has become a full body experience? My pain travels and I have different types of pain, burning, aching, stabbing. Every day is a new pain experience because it's constantly moving and changing. So how do I tell my body that I'm okay when my pain is everywhere? So that's you know, it becomes really, really hard when we have pain in more than one area, and especially hard when we have pain all through our body. This reminds me very much of the kind of information, or kind of statements that people have, or experience that people have when they have fibromyalgia, where the pain is like a moving target. It moves around. So I guess the first thing we need to understand is that when it does this, it will be harder. Any of the techniques that we use will be harder to do in the face of this. However, what we still want to try to do is the same idea. So when the pain is in a certain area of our body, we still want to try to find a way to move that part of our body. Understand that when we move that part of our body, when we get more pain, that our system is trying to tell us that something really dangerous is going on, and that's where we need to make a decision. Is it really dangerous to move this part of my body? Say, for instance, yesterday I didn't have pain in my shoulder, and today I do. And when I move my shoulder, I get more pain. So what you would want to do is say, well, if I didn't do anything to my shoulder between yesterday and today that could cause it damage, then this pain that I'm feeling there must have a lot to do with the way the nervous system is not working quite right. And so you sort of start with this idea of, well, that the nervous system is telling me it's dangerous when it isn't quite so dangerous. And then what you want to do is work on techniques to try to calm that down, which, as I said, we're going to talk more about today and more about next week. But I think the thing to do would be to, when you move those parts of your body, is do your best to keep your breathing as calm as you can and your body tension as low as you can when you move, and move in a gentle way. And that would be a way to start. I don't want to go into it more, but I guess maybe I could say this question, really sum it up, is it's going to be much harder when the pain moves around, but we still want to use the same kind of techniques and the same kind of strategies that we'll talk about as we go through today's webinar and next week. So sort of sit you on the edge of your chair a little bit about that, but we'll get some more information going on that. So the second question was, I'm lucky that I've practiced meditation and I find that I can change the way I perceive pain. So this person mentions that in meditation, often what we learn is this idea that you're supposed to observe your body without any sort of craving for change or having any aversion or negative feelings about whatever sensations we have. So a lot of yoga techniques teach us this, is that you're actually not, a lot of meditation techniques teach us this idea of you're not trying to change the pain. You're just trying to find a way to observe it, and in observing it, it will change in time. So this person's found that they actually can find a way to change the sensation of pain. The question is about sustaining this change. This person writes, I am good at short, focused changes, but I haven't been able to keep doing it. How do I keep my brain going with this? And there's one other bit of the question which I'll hold on for a sec. So I think what we need to do is consider that if you can change the pain while you're doing the meditation or the breathing practice, you've taken a big, big step. And we believe that if you keep on practicing this long enough, what will happen is the changes that happen when you're meditating will start to sort of invade your life. That you'll get a positive change at first only while you do it, but then with time you'll be able to, the changes will last longer after you're done, and you'll find that you can do it in more stressful situations. So I guess my summation of that would be stick with it. You've got the first step of being able to calm it down, and just keep on trying to do it over and over and over again. Like any other skill, you will get better with it as you go on. The second part of the question, the person said, how do I manage the pain so it doesn't wake me up? And this is a really, really hard thing to do. You know, when you're asleep, you're not in control of anything. So I have to say, I don't know how to answer that question. There are things that we can do to try to help us with sleep, but I don't know of any technique that you can do while you're awake that will decrease how much the pain wakes you up at night. So maybe that's something we'll have to try to explore on other webinars that we do. The third question that we got in was, said this, for the last 2.5 years, I've been suffering from pain in my left hip and leg, which prevent me from sitting down or lying down. It doesn't matter what position I'm in. And I can't stand it for more than a few minutes, and it leaves me with no adequate way to rest. I've not been able to obtain a clear diagnosis, such as whether it's nerve pain, muscle pain, or both. And because I don't understand the cause of the pain, I'm unable to know whether an activity such as laying down is actually causing me harm. So is it harming us or not when we lay down, is the person's question here. And should I train myself to ignore it or to interpret it as a warning that harm is occurring and stop or get up and move around? So since I cannot use understanding of the problem to guide me, is there another criterion that I can use to distinguish between harmful and harmless pain? This is a really great question, and it's actually a big part of what we're going to be talking about today is one of the problems that we have is that pain doesn't necessarily give us very accurate information about whether we're harming ourselves. So if we went to a sort of a simple way of looking at it first and said that whether you have chronic pain or whether you don't, if you put enough force on your body, as the force builds up, at some point you'll start to feel pain. Now, we can call that like the first pain. So the first pain that you get when you lay down or sit down or when you stretch your body a certain way, the first pain is your body saying, you know, you got to be careful. If you keep on doing this, you're going to cause damage. So the first increase in pain is not telling you that there is damage, whether it's a chronic pain state or whether it's an acute pain situation. So that you can know that there's not damage happening when that occurs. But of course, the person's question here is that, so I sit there and the pain increases, and so I can say, okay, well, right now when the pain's increased, I'm not damaging anything right now. But if I stay here, the pain just continues to build. And so the heart of the question becomes is, how long should I stay? So what we would suggest is that you want to stay as long as you feel like it's a safe thing to do. So safe for your physical body. And so this person has said they're not quite sure. So the next question we'd want to look at is, well, you only want to stay so long that you don't feel like you're going to regret it later. So if you're sitting there, the pain's building, and you think, you know, it'll be okay, I can get up, I'll move around, and I know I won't be worse for this, then that's an okay thing to do to stay. We know if that's what's going on, obviously you won't be harming yourself. But really, in the end, the question of how do you know for certain? You actually don't know for certain. You need to test things out. You need to start, in cases like this, what you need to do is sort of go up into that edge of the pain and hang out there a bit and see what happens when you hang out there a bit, and see if you can find that spot where you can stay long enough so that you've challenged yourself a bit, but when you get up, you won't be really regretting that you've done it. And so if you can do that, we know that it would not be harmful to you. But unfortunately, there's no way to know for certain. Maybe I can give you another example. We know that when people have rheumatoid arthritis, where they've got, their actual immune system is starting to get the joints in their body, especially in their hands, it's wearing them out and making them rough and damaged. And when a person has that, we tell them that you can't just listen to the pain to tell you whether you're doing too much or too little activity. You need to use the pain as a guide, but you also want to use other things as your guides. So things like, are the joints getting hot? Are the joints getting swollen? Are the joints getting red? And so rather than just using pain as your guide, you've got these other things to use as a guide. In the face of having chronic pain, especially if it's around something like your spine or your hip, where the tissue is really far inside, you're not going to be able to see if the joint's getting red or hot or swollen most of the time. And so you need to use some other guides, and the best guides that we've been able to come up with would be to only do that activity or only stay in that position so long as you can keep your breath calm and keep your body calm, and keep your mind from being really agitated. So you'd want to pay attention to the pain, but also pay attention to these other things as well, which I'm sure a lot of you are getting the idea is of, well, that still doesn't answer the question of how do you know for certain whether it's harming your body when there's that increase in pain, or whether it's the nervous system being agitated. I think what we have to assume is that if you've seen a bunch of doctors and they've assessed you really well and they haven't been able to find something seriously wrong anatomically with the tissue, we have to make the assumption that what's going on is that the pain condition you're having has much more to do with the nervous systems than it does to do with the tissue, so we need to do something to address that. And so I'm a little worried that I'm not being totally clear. So if it's not being totally clear, just stick around, and as we go through the webinar between 12 and 1, we'll be discussing that further, and hopefully that will make more sense. Now, Michael, I did get one other question sent to me before on our site here. And this question was, what's the difference between acute pain and chronic pain that's there all the time? I hurt my shoulder, which is very painful, yet different from my regular pain. So the difference between acute pain and chronic pain, well, what we typically say is that acute pain is much more representative of what's happening in your body. Acute pain usually relates much more. You get an acute pain condition when something's happened to your body, and typically as your body gets better, the pain goes away, or sometimes the pain goes away before your body gets better. But there's this when you have an acute injury, the nervous system works like it's sort of supposed to. In acute pain, what typically happens is the nervous system says, in a short period of time, the nervous system starts to act like, well, that's old news. I know there's a problem there in your body, so I don't need to tell you about it all the time. So say if you sprained your ankle, if you have an acute sprain of your ankle, or for you an acute injury of your shoulder, that usually before the tissue is fully healed, the nerves in the area aren't even sending messages to the brain anymore, because you know that there was a problem, and the nervous system is saying, well, I know there was a problem there, and I don't need to tell you about it 24 hours a day. I'll just tell you about it when you do something new, when you put more force on it. So whereas in chronic pain, what's happening is the system is actually telling you about the pain all the time. And regardless of what position you're in or what activity you're doing, it's as if the system thinks that there's something dangerous happening all the time, and so it's on high alert all the time. In acute pain, you really only get the system going on high alert when you've just injured your body or when you're doing something that would be potentially dangerous. Over in a chronic pain, the nervous system has become much more wound up and really hypersensitive. So again, we will be talking more about that during the session today, and we'll see if that makes some sense. Now, I see there's some stuff on chat here. All right, so Michael, we've got a question you posted from Heather. What technique would I use for neck pain that wakes me throughout the night and I'm screaming in it? Then it takes over an hour for the painkillers to work. This has been going on for months. Oh, Heather, I wish I could tell you exactly what to do. It's so difficult, without, it's the kind of thing that without knowing exactly what's going on inside your neck, it's almost impossible for me to give you good advice as to what to do. Generally, when the pain is really, really bad, we need to look to someone who can provide us, hopefully, with some assistance with controlling the pain, whether that's through medical assistance or medication assistance, or maybe one of the other healthcare professionals, like a physiotherapist, could do things to help to decrease your pain. But what we'd also need to know to be able to give you the best advice around this is to know more of what's going on. So are you dealing with something in your neck where there's a specific injury tissue that's been injured, like a joint or a disc or a muscle? And if we can't find that, then we need to look at to see, how much is the nervous system acting in an unusual way? And it's by sort of sorting that out. Is the problem an acute pain condition that's really bad? Is it a chronic pain condition? How much are the tissues really involved in this, and how much is the nervous system involved? We need to figure out all of that stuff in order to give you any really decent advice. I'm now hoping some of the things we're talking about on the webinars will help you. But if you haven't had this diagnosed and assessed really well, it'd be really great to get that done. And I'm being a physical therapist, I don't know if it taking an hour for your painkiller to work is the appropriate time. Well, I guess what I'd suggest is talk to a pharmacist or talk to your doctor to see, is that what it should be? Is that the best that we can do and what we should expect? So there's a question from D. If the pain is caused by spinal stenosis and a synovial cyst and a Tarlov cyst, will these webinars help me cope with the pain? So I would say yes. But what I'd also say is you're talking about very clear medical diagnoses that need some medical guidance, especially with the spinal stenosis. Some of the cysts that we get around the spinal cord are important, and some of them we don't know how important they are. So you need to have someone help you, guide you with that. But one of the other things is with spinal stenosis, we know that there are specific movements and stretches that you should be doing that will help you out. But at the same time, if you've had spinal stenosis for a long time, there is a really good chance that the nervous system has become sensitized by this, because with stenosis, you do get irritation of the nerves from the spinal cord down your legs. I'm assuming it's in your lower back, not your neck, but it could be in your arms as well. So you can, with the nervous system being sensitized, you still can learn how to decrease the sensitivity. And that's the way it is for nearly any condition, is we want to make sure that you don't take the tactic of the only thing that I need to do is self-management techniques. Self-management techniques are meant to be used as an aspect of what we do around pain management, so to fit into the whole pain care scheme and model or process, where you are using the medical system, using healthcare professionals, using people in the community to help you with activity along with the self-management techniques. So I'm hoping everyone will see them as that, and you'll see them as that D, and realize that they do have some role to play. Let's see. All right, so I've seen another question here from Michael. It says, I've been having chronic tendonitis in my medial foot arch for about 3 or 4 years now, after I hurt while I was playing tennis. I saw a lot of physios and doctors and have done a lot of exercise to try rehab as well. Eventually that chronic pain resolved enough for me to walk and play tennis, but recently I hurt the arch again, and it's most likely tendonitis again, acute on top of chronic. What I guess I want to ask Neil is, what can I do to treat this acute pain as quick as fast as possible? Well, I guess we have to go back to you need to go see someone who can provide a good evaluation of this, because that pain in that part of your foot could be from a joint, it could be from the muscles, it could be from the plantar fascia. So you want to get that checked out. Typically, people are going to want to make sure that you've got the right kind of support in the shoes that you have, so that you're giving the tissue a really good chance to heal up again. So you need to do all that. In terms of the self-management, techniques are become much more important in the face of the chronic conditions, where we're trying to change the sensitivity of the nervous system. However, you can use them in the face of acute pain as well. Acute pain can stress us just the same. It can make us agitated. It can make us hold our breath and breathe in odd ways that actually wind up the nervous system. So they can be useful in acute pain as well as in chronic pain. All right. Another question here is, have I heard, or have you, person asking me, have you heard of positional cervical cord compression, congenital smaller than cervical diameter impacting extension flexion, and its relation to fibromyalgia? I have heard of positional cervical cord compression, but I haven't heard of any relationship to fibromyalgia. So, sorry, I don't know how to answer that one, because I haven't read any information about it, and I can't remember hearing anyone when they're talking about fibromyalgia talking about this. But it would, when I sort of just offhand, it would make a little bit of sense. In fibromyalgia, we have this very wound-up, cranky nervous system. So if something is irritating the spinal cord, it would make sense that the potential is there for it to create wildly different pains in widespread areas of the body. But sorry, I don't know anything beyond that. Then we have a question from Gail, and it says, with the chronic pain, I have areas of my body where I cannot feel topical pain. I cut or burn myself and I can't feel it. I want to know that something has happened if I see blood. Is this part of the chronic pain cycle? That's a great question. I would say that the majority of people, as far as I understand, when they have chronic pain, can still feel sensations in their body. Although in the area of intense pain, it's often hard to feel the skin in that area. People will say that they feel a little bit numb or dull in terms of being able to differentiate, things like warm and cold or scratchy and soft in the areas of pain. If you've got an area of your skin where you actually cannot feel, the kind of thing where you have a cut and you do not feel it at all ever, that's not typically part of the chronic pain cycle. That is more an indication that there are nerves that are actually not functioning. If you get nothing at all with that, which I think you're saying something different from, I've injured myself and I didn't feel it until, I didn't know I had injured myself till I saw the blood, and then, afterwards, while it was healing up and such, I felt some pain from it. That would be more a normal thing, but if you're not feeling any of that, you don't feel it when you do it, you don't feel any pain in the area when you're pulling on a scar, putting pressure on a scar, that suggests that there's actual nerve damage. And once again, I would say, if you haven't, get someone to check this out, because it puts you in a bit of a risk in terms of, if you can't feel your skin, then you can cut yourself, you can burn yourself on certain things, or give yourself frostbite in an area if you put cold on. So not what I would normally call part of the chronic pain cycle. Now, Michael, I think I've hit all the questions that you have in the chat.
Neil,
yes?
I'm just going to take back presenter status. You have, in fact, answered all the questions, or dealt with all the questions that we had from over the course of the week and from the chat. I'm just going to take back presenter status for a moment. We have about 4 minutes until we're supposed to begin part 2.
Okay.
So I just wanted to remind everybody that this webinar is for informational purposes, and it's not a substitute for medical advice. So we strongly urge you to consult with your own healthcare practitioner before you begin, cease, or modify any treatment or medication. So we're going to hand things back over to Neil, and we should be ready to begin part 2 in just a minute or two. Hold on, I have one more chat. Let's just see what we've got going on. Okay. All right. I'm going to hand things back over to you, Neil, and you can begin at your leisure.
So, Michael, are you suggesting we start right into the second webinar?
I believe so, unless we're kind of running out of time for questions. If people have any more questions, please email them to me at communications, plural, @painbc.ca, and we'll do our best to answer them before the beginning of Part 3 at 11:30 a.m. on Wednesday, May 15th.
So should we give people just a minute or so before that anyone else who's going to come in at noon?
That sounds like a good idea. So
okay.
Why don't we we'll resume in a couple of minutes. How does that sound?
Wonderful.
Okay. Okay, everyone. It's now just after noon, so we're going to begin part 2 of our Empowering Self-Management of Pain webinar series. The topic today is what is chronic pain and how to keep moving in the face of it. Thank you very much for all of your questions. And as for questions on this next part, please save them up and email them to me over the course of the week at communications@painbc.ca, or you can send them to us at the beginning of part 3, which will be 11:30 a.m. Pacific time, Wednesday, May 15th, next week. And here I'll hand things over to Neil.
Thank you very much, Michael. And thanks again for setting this up for Pain BC for sponsoring this first webinar. So I'm just starting up the presentation here, and it will be on your screen in just a moment. So you should be seeing a screen that says Empowering Self-Management of Pain. So part 2, today what we're going to be doing is talking about chronic pain and how to move in the face of it. But this week what we also want to do, just this first thing, is we need to talk just a little bit more about how the pain system works before we get into how the system changes when pain persists and the idea of how to move in the face of persisting pain. So I'm hoping that you'll remember as we're going through this that the best thing to do is to take this information and then try to use it along with healthcare people to get you the best guidance for what's going on with you, the best pain care plan. And I also hope you'll consider, as I'm talking about these things, if there are ideas that you have that would make this even better, if there was some information or an idea that you thought we could phrase in a different way, we'd love to get that feedback because part of doing this is to get better at this so we can help more people who have ongoing pain problems. To look at the summary from last week, we talked about how the pain system is an alarm system. And we talked about how the protective alarms that we experience could be pain. Pain is a protective alarm, but it could be muscle spasms, it could be weakness, it could be many other things. We also talked about how danger signals are what the nerves in our body send. Rather than pain signals, they send danger signals. And these signals, when they're heading from our body up through our spinal cord up to the brain, they're changed a lot along the way. Very much like that telephone game that we played when we were kids. And that our nervous systems themselves can change the pain we experience. So when signals are going through the nervous system itself is changing these things. And that'll be sort of good news when we talk about the self-management techniques. If the nervous system is already changing the signals, we might want to try to figure out how we can take sort of access our own ability to change the signals as they head from our body up towards our brain. So you should be seeing a slide now that's got a bit of a visual illusion on it, and it says here that pain has similarities to vision. So we say pain is like vision. It's very much like a lot of the different perceptual apparatus in our body. So if you look at the left of your screen, you'll see a square that has a A in it and a square that has a B in it. And what it looks like to most people is that the square that A is on is much darker than the square that B is on. But the artists, when the artists drew this, drew those two squares the very same shade of gray. And that's sort of hard to figure out. But if you look over on the other one, on the view that's on the right, if you look at the square that has an A on it and you see those two gray bars beside it, you can see that it's exactly the same shade of gray. And if you go down to where the B is, and look at the square where there's a B and those same gray bars, it's exactly the same shade of gray again. And you follow those lines, the bars between the two, you can see it's the same. But I mentioned to you last week this idea that when signals are going from the body up to the brain, what the brain has to do is come up with a sensible story. And this illusion is actually an indication of how the brain doesn't always come up with the right sensible story, so to speak. And that in the picture on the left, the square that has the A and the square that has the B are exactly the same shade of gray. But the reality is that your brain is telling you something that's not right, it's not accurate. And that's the basis of nearly every illusion that we've ever seen, is this, in a way, sort of tricking the brain. The brain gets tricked into thinking one thing is going on when something else is happening. But I want to give you another example of this. So this picture you're seeing in front of you right now, the artist drew it so the gray bit on the top and the gray bit on the bottom were actually the very same shade of gray again. But of course to us they look like the top one's dark and the bottom one's light. And by the way, if you're not seeing them like that, that's okay, because there are some people who their brains sort this out in a totally different way. Now if I cover up part of this picture, so I'll show you this slide, and you should be seeing that same slide, but part of it's covered up. And if you look at that, it should look like the top is almost exactly the same shade as the gray on the bottom. Now, one thing to consider, though, is that, this is a computer. I could be messing with you with a computer. So what I'd like you to do is, if you can, is take one of your fingers sort of in that orientation and close one eye and use your finger to cover up right across the center of the picture you're seeing, so that sort of fold between the two, the bottom and the top. You see if you can put your finger there. And what most people experience when they stick their finger there and they look at it is, it's like if their finger's there, they look pretty similar, and you move your finger out, and all of a sudden they look like the top's dark and the bottom's light. And the reality, once again, here is that the brain, your brain, is looking at the browny gray at the bottom and the blue at the top and the shadow that's there and everything that's in this picture. Your brain takes all that information in at once, and when it gets into your brain comes up with a sensible story. And the sensible story that your brain's coming up with is that the top is dark and the bottom's light, and the thing is that your brain is not giving you the right information. It's actually telling you something that's wrong. Of all the illusions that exist, this has got to be my favorite one, because no matter how many times I look at it, those two tables look like they're different. But the reality is that if you were to measure these, you see that the length and the width of those two tables are exactly the same. Now, if you're not convinced, like most people aren't convinced, what you want to do is just go on to Google later on, go on to Google and type in table illusion, and it'll come up and you can get your measuring stick out there and measure them, and you'll see that they are. So once again, this information is coming through light excited in your eyes, going up to your brain, and your brain's coming up with a sensible story. The sensible story that your brain gets is that one is long and thin, the other one is short and fat, and the reality is that your brain is not giving you accurate factual information. So we come to the heart of this, is that what we see is not accurate factual information. And it turns out it's the same thing through all of our senses. All of our senses do not provide us with accurate factual information. We want them to, and you would think they would. You would think that your eyes would tell exactly what's going on. But all the illusions in the world tell you that that's not the case. Well, pain is a sensory apparatus. Pain is a sensation. It's a lot of different things, but one of the things it is a sensation. And the reality is that pain is not an accurate indication of what's happening in your body. So just like vision not providing you with accurate information, your sensory apparatus around pain doesn't provide you with accurate information. And you can go back to just thinking about what we talked about the first time last week was the whole paper cut. The amount of pain that you get from a paper cut isn't an accurate indication of how badly your body is damaged. So that can be a new thing to sort of, new information, something you haven't really experienced or thought of before. So it's a good time to take a breath in. So as you breathe in, say to yourself, breathing in, I'm calm. And as you breathe out, say, breathing out, I smile. Many years ago when I was working in Northern Ontario, I worked with a woman who would have been in her mid-40s at the time. She was a cashier at a grocery store. And she came into the clinic. When she came in, she was sort of twisted and bent to the side and forward. She couldn't stand up straight. She said that she had been at work a few days before, working as a cashier in a grocery store, and she passed this person this plastic bag, and the person just took it and started to walk before she got her hand off of it, and so she ended up getting dragged sort of across the counter at the cash register. And this caused her back to get quite angry, and she told me that she had actually had pain for over 10 years, that she'd had this lifting injury to her back more than 10 years before, so when she was in her mid-30s. And ever since then, she had pain every single day of her life. And she also told me that she had no idea if anyone could help her with this, because the 10 years before, they took an x-ray of her back, and the x-ray, she was told, showed that she had, her recollection was that she was told she had the worst degenerative disc disease that this doctor had ever seen in someone of her age, which I'm sure you all get that there's some troubles in telling people stories like that, but Of course, we don't know that the doctor said that. We only know that that's the meaning that came out of what the doctor said. So anyway, here's this woman who comes in. She's all twisted and bent over to the side. She can't stand up. Her pain is so much worse now. And so we started trying to do some sort of active physiotherapy, and we found some movements she could do that actually made her pain get less and allowed her to stand up better. And so she started to do these a lot. And within 2 or 3 days, she found that not only has she got straight again and calmed down that new pain again, but the old pain was starting to get better. And so she was really motivated. She kept on doing it, and we found more and more exercises that she could do that made her better, and she regained the ability to do a whole bunch of things she hadn't been able to do. Now, it took a couple months to do that. But over those couple months, she had gotten so much better. She had so much less pain than she had had 10 years, over the last 10 years, and so much better movement. She was convinced that her spine must have been better. And so she went back to her family doctor and got her family doctor to take another x-ray of her back, and brought them back in. She was thinking we helped her a lot, so we must really understand this. So she brought in her old x-rays and her new x-rays, and we put them up and we looked at them, and we could see that her spine definitely had changed. That there were sort of obvious changes between 10 years before and now. But the changes weren't the way that she figured. They were actually worse. Her spine looked much worse. So there were discs that were quite worn out in her back and big bone spurs in her back, and sort of x-rays that if you looked at them, it would be hard to believe that the person could actually be functioning as well as she was, but it was happening. Anyway, and then we had a little bit of fun because we had an orthopedic surgeon working with us, and the orthopedic surgeon had a senior resident with him, and so we showed the senior resident these x-rays of this really quite looking like horribly worn out spine, and said to the resident, okay, the person with these x-rays is out there in our gym exercising. There's probably about 20 people out there, and so we suggested that the resident go and try to find her, but of course the resident couldn't because he was looking for someone who was really incapacitated. He wasn't considering that the person who is most functional there in the gym could have had these x-rays. So the point of all this, I've just gone through talking to you about the idea that pain isn't an accurate indication of what's happening in our body, and that's definitely what we see here with the case of this woman in terms of, her body is the x-rays show that the body is quite worn out, yet she really doesn't have much pain at all. And of course, the example I've given you also gives you the understanding that even now, with the training that we are doing with healthcare professionals, we still have this belief that we're still trying to work through, because we would think that even as a healthcare professional, that if a person has a really, really worn out body that we see on an x-ray, that they should have pain. But that's not the reality. That's not how the pain system works. Some of you may have already jumped ahead and thought, well, if pain isn't an accurate indication of what's going on in my body or how damaged I am, what am I supposed to do with that? How am I supposed to know when to stop? How am I supposed to know whether this pain is telling me that there's something harmful going on? And we will get to that before the end of the webinar today. That's where we're going. So stick with us. So I like showing people this picture. So here's a fellow who's just had a big slurp of a freezy, and he's ended up with brain freeze. And so the question that I would pose to you based on what we're talking about here is the intensity of the pain that this fellow is feeling from the brain freeze an accurate indication of how badly his body has been damaged? And you should be able to come up with the answer of, well, no, he didn't have actually any damage to his body at all. So the next question would be, well, is the location of the pain that he's feeling an accurate indication of where the problem is in his body? And once again, the answer is no. Most people feel brain freeze back behind their eyes. Some people do get it in their throat, and some people feel like it's at the back of their soft palate. But this is a problem of the soft palate being hypersensitive to cold things, and so you get this big, big pain. Now, the last question to ask about this guy is brain freeze a good protection response? And usually what we come up with the answer is, well, no, it's not, because it doesn't tell you where the problem is or what the problem is. But the reality is this is a great protection response. And it tells us more about protection responses because the job of them is to tell you to stop or change your behavior. We want protection mechanisms like pain to be able to tell us where the problem is, what the problem is, and how bad the problem is. But the reality is that these protection systems, their only purpose is to get you to stop doing what you're doing or change your behavior. So we'll talk more about that again as we go along. So imagine this graph in front of you. Up the left side of the graph is the amount of pain that a person would have, and on the bottom is tissue healing. So the red line has to do with damage. So imagine I'm walking along one day and I sprain my ankle. So this red line swoops up to the sky. I get lots of pain, and my body has been damaged. And as my body heals up, the pain will decline. Right? So 99% of the time when we get injured in life, or if we have a surgery or something happens to damage our body, in time, the pain goes away. And what we say is that this is the typical thing that happens with the system. And when the pain does this, when you get this sort of acute injury, you get a whole bunch of pain, and then relatively quickly the pain goes away, we say this pain is more associated with what's happening in the tissues of the body. It's not completely, but it's more associated with that. In chronic pain, things are different. So in chronic pain, we have this big amount of pain, and actually then the pain stays high. And it may actually sort of waver along like this, or sometimes it goes straight up and gets worse. But when we have chronic pain, what actually is going on, we believe, is that the pain has more to do with how the nervous system is functioning, that the nervous system is actually now in this agitated state. And once again, that's not to say there's no problem in the tissue. What we're saying is that in chronic pain, there's actually two problems. There's what we call the tissue issue, right? The problem in the tissues, but then there's the problem of the nervous system being wound up as well. And I want to try to explain a little bit more about that to you. When pain persists, the nervous system is changed. But what I want to make sure you understand is that anything the nervous system has learned, if the nervous system is changed, it can be changed back as well. But so really, really remember that, because I'm about to tell you a bunch of stuff that can be considered to be really bad news about how the nervous system can be changed, but the nervous system absolutely can be changed back again. How much it can be changed back, we don't know for certain, but we know it can be changed some. So when pain persists, we have problems of having changes in the neurons or the nerve cells of our body. We get changes in the nerve cells in our spinal cord. We get changes in the nerve cells in our autonomic nervous systems. And we get changes in the nerve cells in our brain. And I want to tell you a little bit more about how all these changes work. But at the same time, if you've had pain for a while, at the same time as you're becoming more tolerant of the pain, what most of us would assume is that the nervous system is actually becoming more tolerant of the pain as well. But unfortunately what happens the longer you have pain, while you're becoming more tolerant, the nervous system is actually sort of winding up and getting better, because nerves learn pretty much whatever they practice. So we looked at the nerve cells last year, this diagram of a thing that looks like a nerve cell. And what we find is that when pain persists, is these cells, the sensors on the cells, and the cells themselves become more easily excited. Through most of our life, it's hard to get nerve cells to be excited, but if they continue to be excited, they will become more excitable. What you also start to get is that the neurons, when they get excited, they start to send more danger signals. So that you stimulate those sensors inside the nerves. Normally they'd send one or a few signals. Now they're sending many more signals from the very same thing that's happening in the body. We talked about how those nerve cells can get excited by mechanical forces, by temperature, by chemical things. But now we find, in the face of chronic pain, that movement of the body, so normal movement of the body, now actually stimulates these nerves to send danger signals up towards the spinal cord. And we also find that things like light touch or pressure on the skin in the area of the injury will start to get these nerves excited, so they now send danger signals up. So not only are the nerves becoming more sensitive, they're becoming sensitive to things that they never were sensitive to before at all. And you also can get things like tension in nearby areas. So if you have pain in your thumb and you, say, move your elbow or use your biceps, where it actually tension in those areas will send off danger signals towards the brain, so it hurts. If we look at the nerves, once again, at the bottom of this picture is the nerve in the body, and then on top it's the nerve in the spinal cord. the nerves in the spinal cord will start to get more excited. So the longer you send signals through, the more of those chemicals that come out to excite it, the more excitable those nerves get. If you keep on sending danger signals through the system, the nerves from your body will release more chemicals into the spinal cord, and that, of course, will get the spinal cord nerves to send even more signals. And if you keep on dumping more chemicals in there, your body will actually build more receptors for the chemicals, which means that all of this means that now the same signal from your body can get more signals going up through your spinal cord. And so think of it another way is that you can be having more pain when the problem in your body hasn't gotten any worse. So you could have the same problem in your body, yet the system has become so much more sensitive, so much more agitated that more signals are being sent to your brain. So your experience would be that you have more pain. Now, it's really key when I say this to make sure you understand that if this is happening, if your pain is worsening, it would be worthwhile to have it would be worthwhile to have a health professional to do an evaluation to be able to tell you, does it look like your tissues are getting worse, or does it appear that the tissues haven't really gotten any worse, but the more pain must be from the nervous system getting more agitated. And when the signals get up to the brain, we get changes happen up there. There's lots of changes that happen if the brain keeps on getting these danger signals. So most of us find that the longer that we have pain, the harder it is to pay attention to things. It's like the parts of our brain that have to do with attention demand that we pay attention to the pain without paying attention to other things. All the stress areas or the emotional areas and the protective areas of the brain sort of down deep in the bottom of the brain, they all get on red alert. They all get excited if you keep on sending danger signals to the brain. This area of the brain down at the back, at the bottom, that helps you plan movements, it doesn't work as well, so it becomes harder to plan movement. So you try to move, and it's like your body just doesn't move the way you want to. And up at the top of your brain where you feel sensations in your body, often what we find is in the areas of the brain, in the areas of the body where you feel pain, the part of the brain that normally pays attention to that is so focused on paying attention to the pain that it pays very little attention to normal sensations. And of course, in the physical therapy world, that's tough because if you can't feel your body well, it's really hard to plan movement and make the proper movement for your body. And then this area out right at the front of the brain, out on the left, it's an area of the brain that we consider to be part of the sort of control system for the anti-pain activities of the brain. So there's this part of the brain that has a lot to do with turning on systems of your brain that help to decrease pain, to actually block signals at your spinal cord and modify them once they get up to the brain. So this part of the brain, the longer we have pain, it actually becomes less active. And the research has even been able to show that it has a lot to do with being in control. If you feel like you cannot control your pain at all, you stop using this part of the brain. They've even been able to produce this in research studies. We're giving people 3 or 4 uncontrolled pain experiences and looking at brain activity and finding after those few situations they actually stop engaging this part of the brain that would help them with pain control. So the other thing that we see is that you get changes in your body awareness or your body image. If you have pain long enough because of the changes that happen in the way the nervous system works, part of your body, like this woman's looking at her hand, and to her hand feels so much bigger than her hand really is. So this kind of, we call them distortions of the way that our brain is perceiving our body. It can feel bigger, it can feel smaller, it can feel a different shape. When pain is really, really bad, some people start to feel like that part of their body almost as if it doesn't belong to them anymore because it's so painful. And those issues require a lot more than just self-management. When we start to get really significant distortions of the way we feel our body or of our body image, that's where you really want to use the other healthcare professionals to help you out. So once again, lots more information. So take a moment just to take a few easy breaths. Slow it down, your breath a bit, and try to make your breath calmer and your body calmer. We talked last week about the care aide who had injured her shoulder and kept on working through the pain, and ended up with that sensation of it felt like her shoulder was on fire. So I wanted to talk a little bit more about her because her situation was an amazing example of how wound up the nervous system can really get. So here was a person who she injured her rotator cuff in her arm when she was lifting a person at work, and unfortunately what happened was she kept on working for many months afterwards. But then what happened was when she couldn't work anymore, when she looked to get some assistance, she actually had to fight to get care. And we know that one of the things that it can actually make the nervous system more sensitive is when we have to fight to get someone to check us out properly or someone to get us good care. It's almost the opposite of the placebo effect. Placebo effect is when you feel better because you, well, for lots of reasons. Part of it is because you believe that you've received something that would make you feel better. And so the opposite of that is actually called the nocebo effect. Noce has to do with pain. It's when you don't think you're getting the care that you need, this will actually wind up the nervous system. So this person had that happen, and then she actually had surgery for her shoulder, and we know that surgeries can wind up the nervous system. They always do. Typically the system calms down again. But that's another factor for her that could have wound it up. And then once again, when she injured it again, by injuring her shoulder again, that would have wound the nervous system up again, and then she had to fight again. So all of these things would make her autonomic nervous system and the fight-flight system in her body get more sensitive and more cranky, more agitated. And so here you'd see someone that we'd have to imagine that the nerves in her shoulder itself, where she had torn her rotator cuff, that by the time we saw her and the system was so agitated that those nerves were responding. Like when she put her hand on her shoulder, those nerves were responding to a normal touch as if something dangerous was going on. And when she tried to move the tissue or contract the muscles of her shoulder, it took almost no tension whatsoever for her to feel pain, which would mean that those nerves in her shoulder were actually much more excitable now than they ever were before. And because it had been happening for so long, not only were the nerves in her shoulder more excited, but they would have been producing more of those chemicals and sort of dumping more of those chemicals into the spinal cord. And they would have been sending, that would have got the nerves in the spinal cord more excited and sent more signals up towards her brain. And then, as we talked about, the brain would have changed as well. So with the fight-flight system going on, all the emotional reactivity that would have happened because of this, so that here we've got someone who's got a very, very clear injury to her shoulder. And she's got this very, very wound-up, cranky nervous system. So she's got both. And as we talked about, we need to work on both of them. It's not just calming her nervous system down that she needs. She also needs to do things to try to make her shoulder as better as you can in the face of the fact that she had torn two parts of the rotator cuff. But she was the situation that she had was a great example of how so many things sort of come to making the system more agitated. And it's the question that nearly all of us have is, why have I been injured so many times before, and my system would have been really agitated when I first got injured, but then it calmed down? Why did that happen then, and why didn't it happen now? And the reality is we don't know. We rarely, and in her case, we can come up with some pretty good reasons why her nervous system would have got so agitated from this, but sometimes we can't. We look at a situation and can't clearly find what were the specific things. That's probably because pain is changed by everything. Everything changes the way the pain system works. But I want to leave you with the idea here of that when pain persists, even though you've become more tolerant of the pain, we all become more tolerant when pain sticks around. The nervous system inside us, the nerves in our body, the nerves in our spinal cord, the nerves in our brain, the nerves in our automatic nervous systems have all become more agitated. So part of what we need to do to get better is to calm those down. And as I said, we'll be talking more next week about some specific techniques to do that. So back to this question that a number of you may have had. If pain is not an accurate indication of what's going on in my body, if it's not telling me accurately about damage or tissue health, how are you supposed to know how to do what everybody in the health professional world has told you? which is get more active. I'm sure all of you have heard this, that you have pain, you need to get exercising again, you need to get moving again. But most of us end up in the situation is when we try to move in the face of pain, it actually makes more pain. It actually gets the system more agitated. And I want to try to give you a sort of the neuroscience or the pain science sort of underpinnings of that, so you can understand that there is a way that we can try to do this that seems to work. So the slide you're seeing now says how to move when it hurts. So up the left-hand side of the slide, it says tissue tolerance or damage. And you can see that it's trying to show you that if you put force on your body, you usually can put a lot of force on your body before you'll actually damage it. And then on the bottom it says stress or strength. But think about how much the nerves are getting excited. And normally the nerves in our pain system, it takes a lot. So you have to go a long way across that graph before you'll get to a spot where the alarm will actually start, where actually the pain will start. Like if I pull my finger back, there's nothing wrong with my finger. If I have to pull it back far enough to a spot where the alarm goes off. Now if I let go of my finger and move it around, the pain goes away, which tells us that the alarm was there. That first alarm is coming on to say, hey, you know, if you keep on doing this, you are likely to cause damage. So usually, through most of our life, it takes a lot to damage our body, and it takes a lot to get the pain neurons, the nerves in the pain system to fire off. The problem is that things change when we have pain that persists. So when we have pain that persists because we're not as active, and if we've damaged our body, what happens is that now it's easier to damage your body. Your body, you can't put as much force on your body before you would damage it now compared to before. So if I show you this graph, this should show you that tissue damage happens earlier. So if you look up the left side, you don't have to put as much force on before you damage your body. And as I said, that has to do with because you've been less active and you've been damaged. Then if you look at the bottom, you see that the alarm comes on a lot sooner now. And the alarm comes on sooner because the nervous system has become more agitated. So now we move and the alarm system goes off far before the tissue be damaged. And then one of the questions that we had in the Q&A today, hopefully this is making a little bit of sense now when you see this picture. Now there's the other thing that's on this graph here is the flare-up spot. And I want to explain that. What we find is that if people ignore the alarm, so in the face of ongoing pain, if you go up to where the alarm gets louder and you ignore that, you keep on pushing through, what typically happens is if you push hard enough, you'll flare up. You'll get worse pain. The pain's worse for hours or days when you're done before you can actually move again. And one of the problems that we have when we have ongoing pain is that often this is the way that we function. We just grit our teeth. We get up to the pain, we grit our teeth, we hold on tight, and we use our strength of will to push through and do as much as we can. The problem that we have with that is that if you keep on doing that, that alarm that you see on this graph will start to move down and to the left. So the alarm will start to come on sooner. Our body will start to act as if you're not listening to it. So remember, the pain signal is a protection response. Right? And the protection response is there to get you to try to change your behavior or stop. So if you have more pain when you move, and you decide to use your strength of will to just sort of suck it up and grit your teeth and push on through, well, your system is trying to tell you you should stop. But if you don't, it will then change. You will actually start to get more agitated, act like you're not listening. And so if you can't hear the signal, what it will do or what it can do is crank up the sensitivity of the system so that the system will actually start to yell at you sooner and sooner and sooner as time goes on. So one of the unfortunate things that we have looking at this graph is if you ignore the alarm all the time, if you completely ignore it and just use your strength of will and push through, you actually will make the alarm system more sensitive over time, which is exactly the opposite of what you would think. Now I'm sure that there are people that you've met, or you have found that in some situations when you move and the pain gets a little bit more, that you back off right away. So sometimes when the pain gets worse, we interpret the first increase in the pain as being, this is dangerous. I think this really is dangerous. And so if every time the pain increased just a bit, if you were to immediately stop what you're doing. Hopefully you can see that this will, of course, stop you from having any flares up of the pain, but this won't help you get better, because the only way to change that alarm system is to start to push it. What we need to do is start to push that alarm system so that it slowly moves its way back up. We want to change the picture you're seeing on your right back into the picture you're seeing on the left. And the way that we do that is by going up and challenging that alarm system the right way. And when I say challenge, I don't mean like fight it and put the gloves on kind of challenge. I mean challenging it in the right way. And I want to try to explain a little bit more about how you do that. But the essence of these pictures is try to get you to understand just in another way that when you have ongoing pain, not only do you have a problem where the tissue is now more easily damaged than before, but also the alarm system has changed. And so what we need to do is provide you with self-management techniques and a strategy for using exercise so that you can change the alarm, change the sensitization of the nervous system, and then you'll be able to actually change the health or the strength of your tissue so it won't be damaged as easily when you do move. So the first thing that we need to do when we have pain, that's when we want to move in the face of pain, is we need to think about how could we exercise at the place where there's just a little bit more pain. And this is one of these things where you should put your hands on your hips and give me the look and say, well, that's a lot easier said than done. Because it is. It's so easy to say we need to exercise at the edge of the pain, but it's so much harder to find that spot. Like, where is the spot today where if I move, I've just got a little bit more pain? Pain's a moving target. It changes at different times during the day. It changes from day to day. With some of the pain conditions, it changes where it is, not just how intense it is and how easily it changes when you move, but it changes where it is in the body. And so it's much harder to do this, but this is what we have to endeavor to do our best to try to figure out how to find the spot. Where's that spot at first where I can move and I feel like there's some increase in the pain? So when you try to find that spot, that edge of the pain, the edge of the increased pain, you want to make sure that you're not going too hard. So this poor guy down here, he's pushed way too hard, and now he's gotten so hot that he needs some ice. So he overdid it. He pushed too hard. It's too, he went too hot. Whereas this little guy here, it's just way too cold, and it's a little bit like the Goldilocks story, where you need to find that spot right in the middle, or that story of moderation that we hear so much is we've got to find the place towards the middle. That if we push too hard and if we push too gently, neither of these strategies really seem to work. And I've got to say, from my experience of being a physiotherapist and a yoga therapist, this seems to be one of the big things that people have had a hard time trying to find is that spot in the middle. And sometimes you need guidance from someone who's had some experience around this to find that spot where it's not too hot and it's not too cold, or where you don't push too hard or too gently. Once you find the edge of that pain, that spot where the pain's increased a bit, what you want to do is ask yourself two questions when you're there. So the first question you want to ask is this one. You want to ask, is this safe? Or as the fellow in this picture is this really dangerous? You want to be sure that the activity you're doing is an activity you believe will not damage your body. Now you may say, I don't know if it's dangerous. I don't know if it will damage my body. And I would say, okay, well, if you're not certain, but you're still feeling that maybe it might not be, you're okay to carry on. But if you're certain that what you're doing is going to actually cause damage to your body, it's not the right activity to do for right now. I mean, how could that possibly calm down a wound-up, cranky nervous system? Let alone how could it make your body any better to do that? So if you come up with an activity where you say, yes, I believe I'm safe here, then the next thing you need to do is say, well, will I regret this later? Because sometimes you will say, well, yeah, I know I can do it, but I'll regret it later. So what we want to try to find is the amount of activity we can do, or the amount of increase in pain that we have, where we think, yes, I think that if I continue on doing it like this, if I'm at this sort of edge of the increase in pain, that I believe that I will not pay for this later. So you have to figure those out for yourself, and once again, because pain is a moving target, you're going to have to vary this from day to day. It's not going to be the same answer each and every day. So you've gone up to the edge of the pain, you've asked yourself, is this safe, and will I regret it later, and you've come up with the right sort of answers here. Then what you need to do, and this, you see it gets even more complex, is what we want to do is get you to while you're at the edge of that increase in pain. So while you're there, you believe you're safe, you don't think you'll regret it later, stay in that bit of an increase in pain and do your very best to keep your breath calm. Part of the reason you want to keep your breath calm is so that you can send a message into your system that says, yes, I hear that there's an increase in pain, but I know it's safe. If you're breathing calmly, you are, in essence, telling your nervous system that this is safe, so you're going to be keeping it calmer. So you want to do your very best to breathe calmly. Now, before we go on, there's a couple more things you need to do. I just want to make sure you understand that, we'll talk a little bit more about this next week, is if you can't breathe calmly when you're at rest, it's going to be very, very hard to do it while you're moving. So as a physical therapist, I actually get all the people I see who have chronic pain to start to work on calm breathing, to start to get really, really good at calm breathing, which can take 3, 4, 6 weeks to get good at it. And people often think I'm doing it only because I think that breathing calmly will give them less pain. But say, as a physical therapist, the primary reason I want you to be able to do this is because if you can breathe calmly while you're at rest, then there's a chance you might be able to do it while you're trying to move. Because I believe that movement is what's going to help you get better the best, if we can find the right movement. But if you cannot breathe calmly when you're moving, there's no way to calm down that sensitive nervous system. So we need to usually practice it at rest first. So once again, you've gone up to that edge of the pain. You've asked yourself, is it safe? Will you regret it later? You're keeping your breath as calm as you can. But then the other thing you need to do is keep your body tension as low as possible. I saw this picture of this frog, and I thought, oh, that's perfect. The guy's just relaxing back there and just soaking up the sun. I mean, that's probably low body tension. That's what we want to try to do is find, even though you're moving, even though you're doing something, there will be some effort in your body. You want to try to find a way to actually get the lowest amount of tension, especially in those areas of your body where you get gripping. Once again, the idea is if you can decrease the amount of tension in your body, then you're actually sending a message into your system that it's not so dangerous as it's telling you. And then the last thing you need to do is to monitor the pain. So here this guy's checking out this ball. You can imagine that his eyes are totally on that ball. If that ball moves, he's going to be at it right away. That's not the way we need to pay attention to the pain. And it's usually not the way most people pay attention to the pain. This guy, we could say he'd be like festering and focused on it. What we need to do is find the right amount of attention to it, the right amount of focus on it. So we don't want to completely ignore it, because if you completely ignore the pain, you won't know when to stop either. So we need some attention to the pain, but we need to make sure you're not paying too much attention. So if you look at everything that's on this page here, you can see a big, big process. And we've learned this process by listening to other people who have, people in pain who successfully found a way to move again in the face of the pain, to sort of overcome the difficulties of moving. And I can't tell you there's research to back this up. I can only tell you that it's something that a lot of people have found beneficial, and we've been trying it out with people for a long time. It seems to work. But also look at the complexity of this. Often we want a simple solution, but pain is a complex problem. And so for most of us, the solution is going to have some complexity to it as well. And so it's going to be hard. So what I'd ask you to do is when you're trying to do something to get better, right, when you're trying to actually challenge your body a bit, is see if you can find where you can go up to the edge of that pain and exercise there where the pain's increased, in a place where you feel you're safe, where you feel you will not regret it too much later. And while you're there, keep your body calm, keep your body tension low, and do your best to stay in touch with the pain. So don't run away from it. Don't ignore it. So you're going to have to try that out. For now, take a few nice calmer breaths again and just sort of let that sit and see if you can calm down your mind again and maybe get a little bit of a smile on your face as you breathe out. I really learned this idea of this process well when I was working with a fellow. He was a guy who worked on the ferry docks on the coast here, or coast in British Columbia, and he'd been driving home from work one day, and a car didn't stop at a stop sign and went through and smashed right into the driver's side of his car, and I think he had a broken arm and broken ribs, but the big problem he had was he had a broken leg, thigh bone, and lower leg. His arm and his ribs got better quickly, but his leg just wasn't healing up, and they actually had to do surgery on his leg to try to get the bone to start to heal properly. And I think he had 2 surgeries on his leg, and it took something like 4 or 5 months for the bone to finally start to knit back, like to even start to knit back together again. So when the guy came into the clinic we were working at in Vancouver, he had quite a big pain problem. So by then the bone had knit together, but he still had this really quite intense pain if he stood long enough or he walked long enough. And we were taking him through sort of information like this about how hard to push when you have the pain, how to go up to the edge of the pain. But he didn't really like this idea of pushing gently. He said, "It's this is like you want me to do a wimpy exercise. You want me to do a weenie exercise." And I said, well, how far can you walk? Like, what are you doing? And he said, well, what I've been doing for months now is at least 3 times a day I go out and I walk about 3 blocks. And so I said to him, well, so when you're done, how are you? And he says, well, the pain is actually it's a lot worse, and I can't really do much on my feet until the next time I walk. It takes that long to calm back down again. And so I was suggesting to him maybe he should back up a bit and not push so hard. And so I went for a walk with him to see around this 3 blocks, and we were finding that it only took about a block before he started to limp, and his breathing started to get quite tight, and you could see his shoulders sort of picking up around his ears as he kept on going, so his body tension was increasing as well. And now he liked the idea of trying to keep his body calm and his breath calm, and he found that really worked. He was able to go longer and not pay for it quite so much if he went that way. But he kept on. He wanted to do more because he really felt that it was way too wimpy. I think he called them mamby-pamby exercises or something like that, the amount I was asking him to do. So this idea for him of going up just to the edge of the pain, he didn't really like it. And so we started to play around with it a bit. And, of course, this is a guy who had been playing around with these things on his own. He had figured out some of it on his own already. But what I found was really, really interesting. So he found that if he went up to the pain, the spot where the edge of the pain, he said, I can actually push further in than just go to the edge. But he said, I don't have to just go to the edge. I can go up to the spot where, I'm at the edge and I sort of push further and I push harder and I walk faster, and the pain gets worse. And he said, but the pain gets worse, and the pain's worse afterwards for about 2 hours. And his question to me was, is that okay? And so we had to, think about it and talk about it a bit. And really what we came up with was, well, do you feel that the benefits of walking that much, the benefits of doing that physical activity, outweigh the consequences? Right? So his consequences were this big increase in the pain for a couple of hours afterwards. But what we needed to know was, do the benefits outweigh the consequences, which is really what we're trying to get to with this will you regret it later. And what he came up with was no. What he came up with was, yes, the benefits do outweigh the consequences. And he was finding that he could push this hard, and he knew he was safe. He knew that he wouldn't regret it so much later, that he'd actually back up. He found that if he did this, he could actually carry on. Now, the point of me saying this to you is that the majority of people, when we start to try to move in the face of moderate to severe pain, what we typically need to do is go up to the edge. Right? So if that's where the pain gets a little louder, we go up to just sort of below it, and we start tapping it or we start nudging it. And what this fellow had found was that he could actually push in further, and it worked. And so for a lot of us, what we need to do is go up sort of to that first pain or that sort of soft edge of the pain. And then the more we do it, the more we can move in, the more we can push harder. And I got reminded of this again with another person who said, really what I'm doing here is I'm teaching myself, not only am I changing my nervous system and making my body better, but really what I'm doing is becoming more fearless. I'm pushing to a spot where my brain starts to say, oh, I don't know if this is a good idea. And so, there's this woman was saying, I feel like there's fear around this. But what I'm learning is that I can be more fearless. The pain is trying to control me with with the pain and with fear, but what I've learned is I can stand strong and push into it more, and if I do that, not only do I become more fearless, but I become less painful, and I move better. So what we all need to do is we need to find the right words around this, but I think it's a process that's worthwhile to try out. And the last thing I want to mention to you about that, if you're going to try this out, don't try this strategy with all your daily activities. Just start with one or two or some simple exercises. It takes a lot of mental effort to follow this guideline through everything you do during the day. So just try, maybe one task or a few if you haven't tried anything like it before. So if I could sum up what we've talked about today, we want to say is that pain, like vision and all our other sensory systems, is not an accurate indication of what's going on inside the body. I mean, as I said, this is the basis of every illusion that exists. We want pain to provide us with accurate information, but it does not. Just as I'm thinking about it, so many times we feel like back pain. It feels like there's a knife being stuck in our back. Hopefully you can see that just that itself, it's not accurate. This is the system trying to give you something that you will not ignore. But the feeling like there's a knife stuck in your back is not an accurate indication of what's actually happening in your back, even though it is telling you there's something dangerous going on. We also want to remember that when pain persists, the nervous systems become more sensitive. So even though we become more sensitive or more tolerant, even though we become more tolerant of pain as pain persists, at the same time as we become more tolerant, our nervous system is actually practicing. More signals are going through the nerves, so the nerves are getting better and better at sending the signals through, so they actually become more sensitive. The strategy of gritting our teeth and pushing through the pain until we can't continue will help us get daily activities done. And if this is what you do, this is a sign of a strength you have in life. And I'm not suggesting for a second that you throw it away. What I'm suggesting is that maybe it's not working for you now. Maybe it's not serving you in the face of chronic pain. So if you're finding that you're using that tactic of just pushing really hard all the time and paying for it afterwards, what I'd ask you to do is try this other strategy that we've got here. The idea of asking yourself, is it safe? Will I pay for it later? And then doing your very best to keep your breath calm and your body calm and stay in touch with the pain while you're doing it. And the last point of the summary here is that successfully recovering ease of movement requires much more than getting more active. So it's not a matter of just go get more active. If that worked, we'd have very, very few people who have chronic pain because it's what we all try to do. We all try to get active again because we get so frustrated that we keep on trying. So getting more active is the right thing, but what we need to do is figure out how do we do it so we actually succeed. And if I could just leave you with one sort of final message about this is that we see people succeed at decreasing their pain and finding a way to improve their ease of movement when they use these strategies. And when I say success, I'm not talking about getting the pain to all go away, right, or getting all your movement back. In the area of pain management, what we're talking about is finding ways towards less pain and greater ease of movement. We believe it can be done with these kind of strategies, and for any individual, we don't know how much change you can do. But we're pretty certain that for everyone out there, you can make some changes when you can persist. And part of our job on our side as the healthcare people is to try to help you with persisting, help you coach you, carry on. So you may have some questions right now. If you do have questions right now, quickly jot them down so you don't forget them and so you can pass them on to Michael. And then we can talk about them next week. So I'm going to pass back over to you, Michael. So should be coming back your way again.
Thank you so much, Neil. I just want to thank you for sharing your perspective again with us this week on explaining chronic pain and how we can best move through it. I believe that it's going to be very helpful to our attendees. So thank you again, Neil.
You're welcome.